If we look back the evolutions of orthopedics in India, the Dr. Katraks and Narasimha Ayar Chandra were the first orthopedic surgeons in this land. And it was a sister concern of general surgery, and it gets separated and became an offspring of surgery. And Dr. B.N. Sinha and Dr. Mukhopadhyay became the first president and secretary of Indian Orthopedic Associations. We went long back, go ahead, and we formed many subspecialties: Trauma Society of India, POSI, Association of Spine Surgeons of India, Arthroplasty Association, Scopy Association. There are a lot of associations formed under the banner of Indian Orthopedic Associations. But this is a paper of CCUT. They gave a narrative review that the practice, it shapes only the practice of orthopedics in India. It has a little role in teaching and training of postgraduates in India. In India, there is a different scenario, and there is a scarcity of rural orthopedic surgeons, which propels the people to go to the local bone setters. And the current Indian healthcare is primarily urbanized, 75% delivered by the private institutions. It is a paper by Dr. A.K. Jain sir. And we have 206 number of bones in our body, but 63,000 of people access to only one orthopedic surgeons in India now. We have a lot of competitions between bone setters, physiotherapists, pain specialists, neurosurgeons. We are a sandwich between all these specialists. And if you see, in 1995 to 2021, all brand leading medical colleges and institute of national importance, the seats were filled up within top 100 ranks in India. See, this is the 2023 NEET counseling data. Top 200 seats, only 3 people have picked up orthopedics. Only 3. Come to the 2024 counseling data, out of 1,000 top ranks, only 14 people selected orthopedics. What went wrong? What went wrong? Why orthopedics is a sinking boat? We did a comprehensive survey among all the final year students, interns, postgraduate students. We got 9,000 respondents from all leading medical colleges, private medical colleges, Institute of National Importance. Question was designed. We analyzed the scenario. 60% of people said they are self-motivated to pick up medical science as their careers. Only 14% of aspirants of postgraduates, they tell that orthopedics is their choice of the subject. Only 14%. Why you prefer orthopedics? It is a surgical discipline with high caliber, they say. around 60% of people say that orthopedics, we pick up orthopedics because of this. 40% of people say that it is a disturbed work-life balance among orthopedic surgeons. And there is a 38% of people do not know that orthopedics has a good scope in research and publications. We have different personal interest, passion. Somebody has photography, sports, music. 32% of people say that it disturbs your personal life, personal passion. Many of us want to settle abroad, and 54% do not know that they cannot say that it is a good opportunity to settle abroad in orthopedics. And high volume of trauma and emergency is the major preventing factor which prevents them to take orthopedics as a career options. Historically, we have a gender imbalance, but attitude is changing. Girls are also opting for orthopedics. We have a lot of living legends. They are good mentors, skilled surgeons and good orators. We can grasp them and grow with them. We have few suggestions. MBBS should be in MBBS, orthopedics should be a separate subject. There should be no ragging. It is seen that 20% of people leave orthopedics after couple of weeks of taking an orthopedics as a career option. Very important thing, facilitating a balanced working schedule among residents. And we should propagate and project the innovations and celebrate and rejoice the happy moment together. AI, it is not a subject of muscle power and wrestlers. Now we should upgrade the infrastructures and use of AI to keep the track. Policymakers should think and intervene in all possible angles. This is my appeal. Thank you for your patient hearing.